The St. Lucia Medical and Dental Association, SLMDA, comprises more than 200 private and public healthcare providers, most of whom know firsthand how the influx of COVID-19 infections this month has impacted the island's fragile healthcare system. The SLMDA, led by President Dr. Merle Clarke, also advises the island's National Emergency Management Advisory Committee, NEMAC, on the COVID-19 pandemic, now in its third wave. The peaks on the island's latest COVID-19 graphs resemble skyscrapers.
Say shut down the borders, close it.
Right.
Curfew, everybody home.
To flatten the explosive COVID-19 curve, former SLMDA President Dr. Alphonsus St. Rose prescribed another shutdown, which was quickly rebuffed by the Prime Minister.
We cannot shut the country down entirely.
Dr. St. Rose's successor, Dr. Clarke, hesitantly agreed to a shutdown.
It would be easy to say, just shut the borders. I don't want to sit here and me, as Merle Clarke, just say, I would recommend to the government as an SLMD that we shut the borders.
Dr. Clarke's hesitance, as she suggested during a recent appearance on NBC, was rooted in the contrasting opinions among the SLMDA membership.
So is it on the table? Absolutely. And it's, I think, the next poll we're going to have with our members. But when I speak, especially when I speak publicly, I speak for over 200 members of the SLMDA. And I could guarantee you, we do a poll now, half of them will say no. Because this is going to be with us for a long time. There's no question about it.
The SLMDA membership eventually reached a consensus and on January 28th issued a collective statement to the island's COVID-19 policymakers. Shut the country down. They also recommend a 12-hour, 6 a.m. to 6 p.m. curfew and increased testing. St. Lucia is currently under another period of enhanced COVID-19 protocols. The infection rate is at unprecedented levels, despite the rollout of successive prevention control measures. 8 people who tested positive for COVID-19 this month passed away. More than 550 people have contracted the virus since the start of January, and the more contagious UK strain, authorities recently learned, is spreading on island. The SLMDA says St. Lucia's healthcare system has, quote, surpassed its limit and appealed to the COVID-19 policymakers to restrategize, regroup, and reset, end quote. The Health Ministry recently cancelled vacation leave for all public healthcare workers to beef up support at the island's respiratory clinics.
We don't have a reserve. You know, Taiwan is sitting on the 3rd largest reserve of cash. Trinidad can close down its borders. It has $8 billion in reserves from its oil fund. But even in closing down, they have cases. Canada, with closing down, they have cases. In fact, their economy is contracted by 11%. None of us are immune from some of the things that we're talking about. But if we're going to get into the myopic detail of trying to find out whether, in fact, that this makes sense, that makes sense, it makes sense when you look at it from the perspective of how COVID spreads. That is the microscope you must look through.
The latest suite of COVID-19 controls is set to expire on February 1st. The Prime Minister, who to date has resisted appeals to ban leisure travel from high-risk countries, is expected to address the nation before the expiry date. Rihani Isidore, NBC Prime.